question for you to consider is, what is a child's occupation? Can your child succeed in its occupation today? We speak with two paediatric occupational therapists to discuss these questions. Tell me, what does a paediatric occupational therapist do?
It's a bit of a misleading term. I think when people think about occupation, they're thinking about jobs and careers, but really what it means is human occupation. What are the things that are your roles in life, and how do you occupy your time? So when we talk about a child, we're talking about a player, a learner, a student, a brother, a sister, a member of a family system. And so as occupational therapists, we're interested in anything that might interfere with the child's ability to be successful in any of those roles.
So what areas are commonly presented to you?
I think, again, it depends a bit on the age and stage of the child. So early on, we're very likely to see children who are having very defined developmental challenges. So they're not walking when they should be, they're not picking up on their self-care skills, so feeding themselves, beginning to assist in dressing, those kinds of things. But very commonly we see kids when they get to school age and they're not functioning in a classroom as expected, and that could be a skill-based thing, so they're not being able to do the handwriting tasks, or it could be attention and focus, it could be behavior, they're not managing themselves on the playground very well, or they're disrupting class.
So these children are not necessarily choosing to act out in a classroom setting. It's because something is hindering their ability to do the task?
I mean, I think the way that we look at it with children is we all take in information through our five senses, in addition to the sense of movement and balance, and another sense that gives us information about where our joints, our body parts are in relationship to each other, and how much force and pressure to use. Like when we go to pet the cat, we take in all that information and our brain automatically filters and organizes it, so I can attend, like I could sit here and answer your question without falling off of my chair or being completely distracted by everything that's going on in the room. And so it's not a behavioral thing if my nervous system isn't accurately sorting, filtering, and organizing, reacting to the sensory information that's coming in. And so a lot of the children that we see have challenges in either over-responding or under-responding to this information that comes in, which then throws off their function across these environments.
So we would say, I mean, that all behavior is communicative, and that I think the thing that we really feel like our primary role or job is to understand the reasons, or to be the detectives, to give some information about, so why is the child needing to behave in this way? What's going on that we may be able to support in a really different way, so that those behaviors are now not interfering.
Well, and it's not to say, I mean, I don't think coming to us, we would say all behavior is related to sensory, that there certainly are a lot of motivators, and it could be a child really wants your attention, or they want the cookie that's on the table. But a lot of times I think what gets the kids that we see into trouble is there are these other motivators behind the behavior that really are not a choice about behavior. Their brain is just doing the best it can to protect itself or to work in the environment that it's in, and that's a result of that, then their behavior. So
how do you go about coming here? The steps before reaching you?
Often parents will just know something is not right. They will have some concerns about their child's development, and they may or may not have been substantiated by another professional. But so it could be things like a child who's very clumsy and uncoordinated and just can't seem to get pulled together that way. It could be a child that's very picky about lots of things. So food would be one, clothing would be one, really sensitive to movement, and in really overblown kinds of ways, not as something you can sort of coax and work through, but just this huge thing, or gets sick every time you go in the car, or covers their ears, you can't go to the shopping center. It's just not worth the struggle. So you would rather find somebody to be home with the child, or go at a time
online.
Right, exactly.
Yeah, so those are the kinds of things that if a child doesn't have a diagnosis, those are frequently the kinds of behaviors that will bring a family here, that things are just off and in a way that's disrupting this child's success and the family's ease in being a part of the community in the way that they would like to be.
Perhaps you can identify with one or more of the behaviours described. you can be encouraged that many children struggle to sort, filter and organise, and that perhaps something can be done to help.